Good afternoon, everyone, and welcome to this session that is co-organized with WHO and WMO, the World Meteorological Organization. And I have the pleasure to have Professor George Thurston, who is a professor in the New York University Grossman School of Medicine, where he conducts research on exposure and health effect of air pollution, especially regarding the impacts of particulate matter air pollution and its source-specific component. He presently is a co-chair of the policy committee of the International Society of Environmental Epidemiology, ICE, and serves on the executive committee of the US EPA Board of Scientific Counselors. Well, George, thank you very much for accepting.
Oh, thank you for the introduction. So is the correct session listed? No. So this is the sand and dust storms impact on health and early warning systems. Okay, so that's the session you wanted. You're here. Good. This session is jointly organized by the World Health Organization and the World Meteorological Organization. And the intent is to cover the patterns, evolution, and health impacts of sand and desert dust storms, or you'll hear it referred to as SDS, which sounds to me like an anti-war organization. But anyway, Students for a Democratic Society when I was in college. Anyway, SDS for a better subject. Anyway, highlighting early warning systems, a global mitigation actions and tools for public health protection. And, I'm really excited about this session, really. And I don't work directly in this, but, in sandstorm impacts, although I have experienced their impacts in New York City. Yes, I could talk about that later maybe, but we have experience traveling all the way to the city. So, it really, my interest in this, in 1987, I was a postdoc at Harvard Kennedy School working with Haluka Uskanaka. We published the first paper published relating PM 2.5 with mortality across the United States. And in that paper, we looked at it and we looked at total suspended particulate matter, which was basically taking a filter on a vacuum cleaner and sucking up everything and then weighing it and see how much is there. That was what we were regulating. And so we got this data it was the data network set up under the Carter administration, then shut down by the Reagan administration as soon as he came in. This familiar ring? Anyway, and so we had that few years of data. So we looked across the United States at TSP, PM10, and what we called FPM, fine particulate matter, but that was PM 2.5. And we also had trace element constituents. And so I did a source apportionment applying a technique I developed my dissertation at Harvard and attributed the various effects of PM 2.5 to sources. And we looked at constituents. This is 1987. And so the conclusion of the paper basically was that the effects of particles vary with size, composition, and source, and that those all have to be considered. Over time, we slowly, a few years later, they went to PM10, so they cut out the very large particles and just the ones that get by the trachea. And then another 10 years later, they finally got to 1997, they got to PM 2.5. They finally said, okay, but this is the part it's more relevant to health and we should regulate. But the other parts, the composition and source, it's been a while, and we still really don't address that in our regulation. So that's why I'm really excited that the World Health Organization is looking at this. They're looking differently at the sandstorms, looking differently at, we saw wildfires as a distinct source. I mean, okay, just to back up a little bit, we talk about gases and particles, right? When we regulate, when we analyze things. And the gases, we say, oh, well, there's oxygen, good for you, ozone, bad for you, SO2, NO2. And then we look at particles as a class of pollutants, and we weigh them, and we don't differentiate between them. So now World Health Organization is starting to recognize this and treating the biomass burning in homes, indoor, as a separate entity that will assess its health effects separately from the urban pollution, which is what our standards are basically based on, and also looking at wildfires separately and sandstorms separately. So this is a really positive, and then we can look at them, and some of these papers we have today look at this question, how do these sandstorm pollutants, their health effects, how are they similar or different from the effects of the pollution that we're exposed to every single day, every day of our life, year after year, and which is mostly fossil fuel combustion particles. And so that's, to me, the exciting part of the the day, that we're making progress in World Health Organization. They're looking at good practices and trying to say, well, maybe we should be looking at these other things as well as the things that we've always regulated. So, our first presentation, yes, is this right? Yeah, good. Is from Sarah Bassett, who's a scientific officer at the World Meteorological Society, and talking about sand. Yep, says the same thing here. Sand and dust storms, definition, occurrence, and how public health protection needs to adapt to a changing climate. So, come on up.
Oh yeah. Thanks a lot for the introduction. It is the World Meteorological Organization. It's one of the United Nations agencies, specialized in weather, water, and climate. And because of that, it's playing a quite important role in these discussions on sand and dust storms. And today, I want to introduce you basic concepts that are important to be in mind for health assessments and health strategies. When we are thinking in sand and dust storms, always we are thinking in areas where are having sources, and as you can see, are very extreme events, that is soil that is having grains that are available to be uplifted, and they are uplifted by the action of the wind. And this is the sand and dust storm, when you have the phenomena that uplift these particles. And as you can see here, we can see different escapes from Middle East, mostly. And you can see the impact at regional level. This is Eastern Mediterranean, is over Syria, and you can see how the images in satellites can track very well this phenomena. But also it's not just sources. This is landscapes from Europe, and as you can see, even Switzerland, Paris, or closer areas in the Mediterranean, like Almeria in Spain and Crete, are very strongly hit by this phenomena. Why? Because the wind, the action of the wind is advecting this sand and dust to any part of the wall, meaning north, east, west, depending on the big source it is. But also we have local sources. This is an image in Turkey where a strong sand and dust storms came from the inner sources. Then you have to imagine that it's not just big deserts. We can have sand and dust storms any part of the wall. And this is the reason the impacts that we know that sand and dust storms has in different socioeconomic sectors, that the United Nations General Assembly proclaimed 12th July as the International Day for Combating Sand and Dust Storms. And this day is really aiming to raise awareness about the importance for health and sustainability connected with this important natural hazard. Also, there is a coalition of more than 20 UN and non-UN agencies, that is the UN Coalition for Combating Sand and Dust Storms, that we are trying to coordinate the efforts to really has a strategy against these important impacts that all the countries of the world somehow are suffering. And on top of that, also United Nations declared 2034 as the decade to combat the increasing sand and dust storms from Africa to China, but these global impacts. Then you can see here the importance of the topic at the UN level, at international level. And why? This is a nice image coming from NASA, from a reanalysis of NASA, and the reddish color are showing you the extension of Saharan dust, for example, crossing all the Atlantic and hitting the Americas, but also we have important sources in the Middle East, in China and Asia, the Gobi and Taklaman, but also Australia, South America, North America, we can see some hot spots. And this is having an annual cycle that is moving along the year with maximums in June, July, and August in the Northern Hemisphere, and in December, January, and February in the Southern Hemisphere. But as you can see, it's a global phenomena, and no single country is free of the impacts of sun and dust storms. And this is only the global impacts. We are not looking at small sources that sometimes are hitting more strongly cities and lives. And why we think that it's important to mention that sun and dust storms, sun and dust in this case, are important in the climate system, because the implications and the interactions with different elements that we have in this climate system. The direct effect is connected with radiative forcings, meaning increasing of temperatures, but also as having this indirect effect connected with cloud formation and precipitation, meaning another impact in the climate system. But also on top of that, the deposition of aerosols on the cryosphere and the glaciers is accelerating its melting. Then is another impact that we have to be in mind when we think in this climate element. Aerosols are having an important component in the climate system. And what means this when we think in climate change and how is hitting these high temperatures, changing precipitation, but also water management, is affecting the sources. We have to be aware that drought and desertification are key to create new sources that potentially at the beginning were not sources of dust, but with the effect of these two phenomena, we can create new sources like desiccated bodies. This is Urmia Lake in Iran, and you can see from one year to another year, the content of water is extremely different, and when it's desiccated is when it's starting to emit a lot of aerosols. But also, another impact that climate change is coming to this discussion is this high latitude dust. Why? Because the ice cover is reduced, and now we start to observe new sources of dust emissions in high latitude in the south and in the north. And in the satellite images that you can see here is the example of Iceland, that is proclaimed the largest desert in Europe, but also in Patagonia, and we can find examples in all these regions. There are specific researchers that are tackling this impact, and the importance here is to understand that you can see the different colors of these aerosols. This means different compositions, and this is very important in climate, but also health terms. And coming back to what the WHO air quality guidelines are mentioning, is that specificity is telling us that there is insufficient quantitative evidence of the impacts of sun and dust storms and other aerosols, basically because these two components, the size, distribution, and the chemical composition. We are having sun and dust is having a very broad spectrum of sizes, from very large particles, the sun part, but also dust is coming from the PM10 and PM2.5 fractions. Then it's not well understood what is the most harmful part of this spectrum of particles, but on the other side we have the chemical composition. You have to imagine that sun and dust is not a single particle, it's an agglomeration of different minerals. And in the image that you see in the satellite, this is Libya, is in the north of Africa. You can see perfectly how important is the sources to give us an idea about the chemical composition and how different can be the composition of these dust storms depending on the soil where it is emitted. And it's because all these climate, weather, and optical properties and other effects that the WMO, the World Meteorological Organization, launched in 2007 an international research initiative on sun and dust storms, which is the SDS-WAS, that is the acronym for Sun and Dust Storms Warming Advisory and Assessment Systems. Why we are working in this concept? The concept of the SDS-WAS is regional. We are gathering experts from different regions because we know that each region is having their own particularities. And nowadays we have 4 regions that are coordinated by DAS regional centers. Basically, these dust centers are gathering all the community and products and centralize all the training activities for the region. And nowadays we have one in Barbados, one in Barcelona, Spain, one in Jeddah, Saudi Arabia, and the one in Beijing in China. And what is the ambition of this sun and dust storm warming advisory and assessment system? It's to create science for services. The main objectives that we are looking for within the sun and the SDS WOS is basically to create international coordination of research for weather and climate, because it's clear for us that is a hazard that needs to be tackled not only at weather but also climate scales. Also, the identification and assessment of the sun and dust storms impacts, and health is one of the priority impact assessments that we need to address. Also, promoting the use of current available products, meaning observations and modeling products. Here, the forecast can be a good tool for creating warning systems connected with health, and also building capacity and facilitate access to all these services. It's a very big community of providers, researchers, and users that we are trying to promote these services and give you insights of how beneficial can be in your activities. And also, of course, we are working a lot in dissemination and awareness. And here's the big piece of work that we are delivering to the society is these early warnings. We are trying to promote the use of forecasting systems and the incorporation of observations to deliver the most accurate impact-based assessment that we can provide to the health community or any other sector that is hit by sun and dust storms. And with that, I want to emphasize two final remarks, that you have to be in mind always that sun and dust storms is having impacts in climate, environment, and on top of that, health. And also that at WMO, we are trying to provide the best science, the best data, and to support early warning system to help nations to mitigate and to the risk posed by sun and dust storms. And with that, I want to thank a lot all the WMO experts that are today in the room, that probably you will meet in the next panel session. And also in the satellite image is in the video that you can see in the image, you can see Godzilla. Godzilla was one of the most famous sun and dust storms that happened in June 2020. And it was a Saharan dust storm that was hitting a large part of the Central America, also North America, because it was hitting Florida. And it's one of the best examples of why we are always taking a look to sun and dust storms when we are talking about transboundary pollution. And again, thanks a lot to all the experts that are contributing to this SDS WOS.
Otherwise, we can move along and have the next speaker. Okay, thanks. Okay. Yeah, the next. Oh, yeah. Yeah. Yeah, we save time. Okay, we're done. Okay. All right. Are we set? No. Well, I'll start anyway. Just Francisco Forestari is here as the next speaker, and he's an environmental epidemiologist who currently serves as a visiting professor at Imperial College in London, as we know, in the Environmental Research Group, and he's worked as a public health officer for almost 4 decades in the Department of Epidemiology, Lazio Region Health Service in Rome. And so, oh, you can use this one. Yeah.
Thank you, George, and this nice session. I want to say before starting that we have, for Desert Dust, we have a song that some people may recall. Johnny Mitchell, Carey. Can you hear me? Yeah. So there's a place in Crete, Greece, which is called Matala. And in the 60s was the place for hippies. And the hippies would go there and sleep on the beach. And Johnny Mitchell was there. And the song starts, the wind is in from Africa. because Matala was very often hit by the desert and the storm. Very pleasant place. So I'm here to present the work that Aurelio Tobias, together with others, have done within the WHO group. So I'm presenting basically the work with some of my comments. And the idea is what we know and what we don't know. So this is what Aurelio says is the work of the advisory group on desert dust and health. So review and provide advice on assessing human exposure, provide guidance on the assessment of long-term impact of desert dust. We will see, this is an issue. Review and provide advice on the public health response to desert dust and sun and dust storm. Develop the WHO air quality guideline good practice statements and support the peer review process of the WHO WMO report on desert dust and health. So let's see the main research question that we have. So what are the short-term effects of desert dust on daily mortality and morbidity? And the basic question is PM10, PM2.5 from desert, the same acute toxicity of PM10, PM2.5 from anthropogenic sources. And the second question, what are the long-term effects on mortality and morbidity? And has PM10 and PM2.5 the same chronic toxicity? So we remain with this question, and we have some of those questions have been addressed, some are still to be addressed. Just to complement what Sarah has been already saying, is referred to a mixture of PM emitted from arid and semi-arid regions last few hours in the source region, but can be transported at different altitude. In dust episode referred to dust events in the area affected. The size and the composition, which was the question from George, varies according to the various sources. And during the transportation, the cloud can be absorbing some other toxic material and can be absorbing also bacteria and other toxins and allergens. And then there is another phenomenon which has been already shown, especially in Barcelona. During the storm, the boundary layer is much lower, so you have a concentration of the anthropogenic PM. This is a picture very similar to what has been shown by Sarah. It's quite interesting, this migration in the southern European countries, and these are probably occurring in different months during the spring and the summer. We have this migration towards North America, and this is quite interesting, but also Patagonia is affected and very much the Asian part. The exposure assessment is quite complicated because you have to identify the dust episodes, and you have several instruments that Sarah can tell you more about, and especially using satellites. And to quantify dust exposure, you have several methods. One that has been very used in the is actually used in the European Union is what we call the discount method, because actually in the present legislation, each member state in Europe should report the PM10 values to the Commission, but anything coming during the desert dust episodes can be discounted from the reporting. And there is a methodology which is still going on. Legislation is still going on also with the new directive. What is important also for the epidemiological studies is the way to address the issue. And one is what we call the binary version of that. Is basically the question, is mortality and morbidity affected during the desert dust days more than the other days. So it's a yes or no question. The second is dust as a modifier. So basically, the PM during the desert dust days is more toxic than the PM during the non-dust days. And there is a third approach, which is more complete, is what we call the continuous approach, is the PM10 or PM2.5 coming from the source, from the desert, different than the PM10 or PM2.5 coming from anthropogenic sources. And what they have done as a group, first of all, some years ago, they published an overview of the, it's a narrative review of the available studies. It was quite impressive to see that there were 204 epidemiological studies with different sources of the dust from Asia, mostly from Sahara, but also Middle East. The study design was mixed. Some were time series studies, but also they call longitudinal and some cross-sectional studies, so very mixed study design. And looking at the metrics, most of them were binary. So how is mortality during the dust episodes? Effect modifier, and only few were addressing as a continuum measure. The outcomes were morbidity, symptoms, and mortality, and respiratory, cardiovascular conditions, and even infectious diseases. And what they say in this narrative review, 85% of the studies reported adverse health effects. You see here, this is not systematic review, there is no meta-analysis here. But later on, quite recently, the group published a systematic review for the WHO quality guidelines, and 71 time series studies were involved. They were studying all-cause cardiovascular and respiratory mortality, responding to the binary question, let's say. Is mortality different? And basically the response is yes. For acute mortality, all-cause mortality is 1% more. For cardiovascular mortality, 2.5%, and for respiratory mortality, almost 7%. So respiratory mortality and cardiovascular mortality from the systematic review seems to be higher during the dust days. For the few studies that addressed the issue was more for PM10, relationship was more for PM10, there was no relationship with PM2.5. The evidence was, the quality of the evidence was assessed as moderate, and there were several limitations in this literature reviewed. There is a nice paper from Frank Kelly and Julia Fessel on the toxicity of the mechanism underlying the toxicity of the desert dust for the respiratory effect, for the cardiovascular effect, but also the biological mechanism. I think we should refer to this paper because it's rather complete. The final remarks from Aurelio, it's that the exposure metrics method for exposure assessment and desert source are influencing the effect and the study design. We have evidence for short-term effects of desert dust exposure, especially on cardiovascular and respiratory mortality. Still limited number of studies in some areas of the world. We don't have any response, any study for the long-term effects. And what is important to know that this is a recent paper that came in the Lancet Planetary calling for more studies on desert dust, that the intensity and the frequency of this episode has been increased during the last period. I want to address the issue of the long-term effect because for some countries in the world, especially in the Middle East, it's not an issue of episode, it's an issue of chronic exposure. And for this chronic exposure, the desert dust component of the total PM10 and PM2.5 may vary, but in some situations, at least half of the total concentration is due to the desert. So the question is this desert dust dangerous for health, I think we should still have an open question mark. Thanks.
Okay. Well, I just wanted to, well, get a question. Good. But I just wanted to use my prerogative.
Okay.
and ask, you know, I looked at these papers, and, you know, when you're looking at the event days, you're talking about like 100 micrograms per meter cubed.
Yeah.
But those percentages seem comparable. You know, at first you say, oh, that's pretty similar to what we get with PM 2.5, but that's per 10 micrograms. So really, we're usually talking about like
different
10
scale.
times as much pollution to get a similar effect.
So this is true. It's very difficult to rely on the studies on the desert dust days. We really need more on studies on the continuous exposure.
And as you said, so the review seemed to indicate that the effects were in the larger particles, which makes some sense, and probably by different mechanism than urban particles.
Yeah.
And the smaller particles were significant for the non-pollution, not, you know, the regular days, but not for the, you know, PM 2.5 on the.
Yeah, although you know, during the desert dust days there is some increase in PM2, also in PM 2.5. So it's not only the coarse particles that increase during the desert dust.
But those weren't significant.
Yeah, it seems. It seems. Yeah, it seems. Yeah.
Whereas the regular days were in those
Yeah.
studies.
Yeah, it seems.
Really focusing, and the most consistent results were in the respiratory.
Yeah.
Not so much.
Which in a way is consistent with the idea of the coarse particles.
Right.
Yeah.
So
Was the guy?
One.
More or less the same question you made. So clarification about what levels are we talking about? So how much comparing to the limit values, the quality guidelines, and because that makes the difference, no? So it's to understand how much was the mass we are talking about.
Yeah, yeah. You know, responding to this, this is varies very much on the location. But I recall in 2013 and 2015 we had a large project in southern Europe in the Mediterranean area. So we estimated the PM10 component from the desert and the PM10 component from the anthropogenic source. And during the desert dust days, the extra contribution from the desert in the southern Mediterranean area was about 10-15 micrograms cubic meter. So the extra was not 100, you know, let's say. So this is southern Europe. Is maybe different in Iran or the other place in Middle East. But many of the studies, they come from areas that are not greatly impacted, to note. Okay.
Yes, our next speaker is Tian Li, Deputy Director of the of the National Institute of Environmental Health in China, CDC, and her work delves into climate change, air pollution, and health impact. She's been honored with the 2024 Distinguished Young Scholar Fund from the National Natural Science Foundation of China and the 2022 China Female Scientist Award from Cell Press. As a corresponding author, she's published over 100 papers in Nature, The Lancet, and others. And I have a Tian. I looked it up, and it means sky. Is that right? Tian means sweet. Oh, and it said sky. I thought sky would be appropriate to our topic. Another, yeah. Okay. All right. Anyway.
Thank you. Thank you. Yeah. Okay, it's my great honor to be here to share our work in China. Okay, first I will give a very quick introduction of sand and dust storm in China. Okay, this figure shows the source and the sinks of the sand and dust storm globally. And China is actually the northwest China lies in a major dust source region, and highly prone to the sun dust storm. And actually, China has actively promoted the sun and dust storm response by launching the world first law on SDS control in 2002. The name is Law on Prevention and Control of the Desertification. And China actually developed a very highly effective China model experience with government-led policy draft, technical support, legal governance, and incentive drive and sustained efforts. And actually, over the past 40 years, 53% of the desertified land has been effectively managed and achieved the world's first zero growth in land degradation in 2024. And China actually twice honored by UNCCD for the outstanding contribution to combating the desertification, and also just mentioned in the first maybe the internationally leading the SDS forecasting technology, one of the only two for the global regional specialized meteorological centers. And however, although we have lots of significant progress on the sun and dust storm, however, under the changing climate, China experienced the SDS occurrence in 2021. There's a very big one, in a decade. On March 15th, 2021, you can see the PM10 and the PM25 levels. PM10 is 36 times above the AQG level, and the PM2.5 is 40 times. And facing this SDS reoccurrence, China implements new SDS response measures and a health priority development strategy. That is health in all policy, and we continuously strengthen the South area management from the domestic and the international perspectives. The domestic perspective will, the construction of ecological projects and so on. And for the international, strengthening cooperation with neighbor countries, supporting the desertification control in other countries involved in the Belt and Road Initiative. Meanwhile, the international community also attach greater importance to SDS health impacts, such as the air quality guideline and SDS early warning system. So there is an urgent need to conduct health research to support the evidence to support the response to SDS. Second, I will introduce some new evidence from China. Okay, so in response to the SDS reoccurrence, actually China's scientific community actively advanced SDS health research. The Peking University, led by the Professor Tong Zhu and Professor Zheng Mei, we have a very quick forum and a workshop to discuss the SDS cause, transport, and environmental impacts, health impacts, and so on. And our Natural Science Foundation of China quickly responded with this project announcement. I'm very lucky, I got the funding from this, research project. And here are some, new evidence. It's from the acute effect side, perspective. First, we found the broad spectrum of sensitivity, not just the respiratory, but also cardiovascular diseases associated with the SDS events. You can see a whole bunch of the spectrum of sensitivity disease here. And compare with the non-SDS day, we found that the highest increase about 12% increase. And also we compare this with highway pollution events. And we found SDS events health effect are comparable with the regular PM2.5 highway pollution events. Even some, like ischemic stroke and so on, a little bit higher than the, highway pollution events. And also we compare, it's very interesting, we compare to PM2.5, we found per unit increase in dust PM2.5, that is the red one, concentration, shows, great health effects than the PM2.5, that is the blue one, And we're using this, exposure response relationship to estimate the burden of dust PM2.5 and we found the dust PM 2.5 is higher than that of the dust PM 2.5 to 10. Yeah, this is maps of the burden of the mortality. And also very interesting, we found burden in dust deposition region is higher than in south regions. And also we use the exposure response relationship to estimate globally, and we found 0.5 million global dust PM related deaths annually. Actually, it's a very big number, with dust PM 2.5 accounting for over 15%. So I think all these results highlight that dust particle matter pollution is not only an issue for dust south regions, but also a major global public health concern. Yeah. Okay, so last I will give a very quick introduction for the potential evidence-based public health actions. This is a paper we just published on Lancet Planetary Health with 28 experts from 15 countries. Yeah, we built an international collaboration network to advance SDS health research. And in this paper, we have 5 parts. The first one, we introduce definitions, source area, and so on. And then we give some trend of the recent SDS occurrence or reoccurrence. And the third is the response from international communities. And first is area required focus epidemiological study. And last, we calls for international health studies. Here is some knowledge gaps I will skip. So this is the last one. We propose 5, aspects of the international health studies to fill these knowledge gaps. The first one is far for me. We need, epidemiological models, to the regional characteristic, assessing the short and long-term exposures, And the second, we need, the acute and chronic health effects of SDS event and dust, particles exposure on various diseases. And the third one is the health impact of PM with different size and composition during SDS. And the first one is the health impact of particle compared to other source particles. Yeah. The last one is effectiveness of particle health, public health intervention during SDS. And we hope using all this, evidence to support the targeted response strategies, in the future. And the last, I'm going to share with you a very beautiful story from China. That is China Saihanba story. In Saihanba, after 55 years of the effort across 3 generations, increased the forest coverage from 11% to 18%, and creating the world's last man-made forest, honored with the UN's Champions of the Earth Award, from one tree to a forest. That's all for my talk. Thank you so much. Yeah.
Any questions? Okay. Well, just a quick. Okay, so that didn't seem, the China experience doesn't seem consistent with the review that was done by the World Health Organization, in that you were finding effects in cardiovascular. And so what do you ascribe that to? The contrast between your results and the review that was done. You have much stronger effects by the dust, the sandstorm events. And do you have any idea why that might be? Is there some difference in the nature of the particles or the freshness of the exposure, perhaps? If the
I think it's mostly it's the particle matter. PM 2.5 maybe it's the main reason for the cardiovascular diseases during the
sure, but why those PM 2.5 and not other places with the PM 2.5 from sand didn't seem to have much?
You mean for the PM with compared
sandstorms? The PM 2.5 in sandstorms.
Yeah, okay. I think maybe during the sand and dust storm there may be some organic, because we have measure the PM filters, and we found more organic particles on during the sand and dust storm events.
So this
when we transfer to the to the very long areas of transfer from a long distance, and maybe there are many
Yeah,
organic compounds.
I alluded to earlier, in 2001, in April 2001, we had a monitor in the city and one in the outside the city in our research labs in Sterling Forest. I was in the city, and all of a sudden the silicon levels shot up really high, and I thought somebody sandblasting a building or something. And then I looked at this monitor outside the city, and it was exactly the same. And I said, "Ooh, this is bigger than just one local." And then we started looking at trajectories and satellite photos, and there was a Gobi desert event, and it went across the Pacific and hit LA, and then it hit St. Louis and Chicago, and then eventually hit New York. And we documented it with pictures, and the EPA also looked into it. Yeah, so they do travel. So there's like the fresh versus transported.
Yeah.
I don't know what effect that has.
Yeah, maybe we can discuss later. We have
Yeah.
many, filters. Maybe we can collaborate in the future to see, what happened. Yeah, in the, desert area and in the city. We have
It's
many
an interesting
filters.
dichotomy.
Yeah.
Anyway, but
Okay.
you had one young man. Who are you? Introduce yourself.
Okay, now I want to say that, my experience, the desert dust comes with different temperature. Usually the temperature is higher during the desert dust. So modeling in this time series studies is very difficult, very sensitive to the temperature effect. So since you see a 20-25% increase, which is very high, so I suggest to make several sensitivity analysis on the modeling of the temperature, because the results may be sensitive to that.
Okay, thank you so much.
Thank you very much.
Okay.
All right. So I guess we're now at the panel discussion point. So if the panel members would come up, and we have questions for each one. So you know who you are, but I'll introduce each one, and then ask the question that's been designated. So I guess there's a. Yes, sorry, I think there's like two few seats. So it's sort of musical chairs. There's one chair here, yeah, that's not as cushy as the other. Yeah. So it's musical chairs. And then after each speaker, we take out the chair. No. All right. So we can share this. The first panelist question I have is for Kara D. Wright. And let me do the introduction. It's all here somewhere.
I can introduce myself if you like.
Oh, I got it now. Sorry. Yeah. It's just a matter of flipping pages. She's Chief Specialist Scientist at the South African Medical Research Council, leading the Climate and Health Research Program, and an adjunct professor at the University of Pretoria and UJ. And her research focuses on climate change, air pollution, environmental health, policy development in Africa. And she studies solar UV radiation and skin cancer prevention with over 200 peer-reviewed articles. And the designated question is, what are the key ingredients for an effective institutional response to protect the public from STS, such as health surveillance, efficient and timely coordination, and what stakeholders or resources tend to be missing in that public health response?
Yeah, that's not tough, is it? Thank you. Thanks for the opportunity from WHO and WMO to be sitting with you today and chatting about this. And I think just to start that I come from South Africa, and we've begun to see an increase in dust storms, particularly in the interior of our country. And my team and I made an attempt to try and see if we could deduce any health impacts from a dust storm that occurred not too long ago across our Northwest and Free State provinces. And it was really difficult to do that because we don't have the data like you do for all these huge studies that you've been presenting earlier. And I think this is something that in LMICs, we've got a real challenge. But yeah, this is something that we are starting to see more and more, and I'm pretty sure it does connect with climate change. John and I spoke earlier about potentially using a framework, which is up on the screen now, to kind of ground how we would try and answer these questions. And before I do that, I just want to rewind and say that most of the sand and desert dust is coming from sources that are not anthropogenic. So on the WHO website, where they're talking about sand, desert dust, an estimated 25% of dust emissions originate from human or anthropogenic activities, including things like deforestation, land degradation, unsustainable land management, climate change because of desertification, and water mismanagement, which is what we've seen presented in the previous presentations. So that leaves 75% of the challenge from sand and desert dust coming from nature and deserts. I was very honored to serve on the WHO Air Quality Guideline Development Group. We did work, I think, between about 2015 and 2019, ended in 2020, just last meeting just before COVID. And I remember many, many debates around sand and desert dust and, you know, what are we going to say about it? What can we recommend? And what should the responses be from these different institutions, which is exactly the question that's been posed to me today. And obviously what came out of that was there couldn't be a guideline for it, but there was this good practice statement, which if you read it, had some excellent advice. So I'm going to take us back to this diagram on the screen, which essentially is speaking to the need for an air quality index framework so that we can take science. Remember I said we don't have data in South Africa about this, but there is data from other countries in the world. Take the science to understand the risk and then think about how we can do something about it. So the two things that then you really need is the evidence to support the health effects. So you're monitoring and measuring your air quality index and all these things, the different PM particles and sizes. And you are thinking about what are the impacts. And unfortunately, in most countries, the governments want to know what's going on in their own country. I can't take what's being done somewhere else in the world and say, well, look, it's happening there, it's probably happening here. We have to gather our own data. And then we have to think of the best ways in which to protect our people. And I think some of the challenges are that we are just missing copious amounts of resources. This is especially in LMICs where sand and desert dust is a major challenge. So we might say things like, you know, we're going to share with you an early warning piece of information that there is going to be, and I can speak about a dust storm because that's what we have where I live, but what are we going to tell people to do about it? And I was looking at the artwork by the Chinese children in the foyer earlier, and it was keep the window open for fresh air. Well, in the middle of a dust storm, you don't want to tell the people that. You want to tell them to close the windows. So there's this confusing messaging when it comes to air quality in terms of keeping people safe in their homes or in their schools or in their places of work. And it's also not necessarily practical in the low and middle income country context to say, well, when you have a child who is suffering with some kind of respiratory condition and you know that you live in an area with sand and dust really prevalent, you should really have an air purifier, because I can't necessarily afford enough air purifiers for my own home. No, I don't think many people in my country would be able to do so. So in terms of what the current responses are, I think we've got limited early warning systems to support the need to share this knowledge. We may be able to say what the air quality index is, but are we really getting to the provision of information, especially to vulnerable groups in real time? And
I think that there's a lot of scope for what John was talking to me earlier about strengthening this air quality index framework to get us to the point where we really can protect people in what is, in fact, a really wicked problem of sand and desert dust exposure.
What, you want me to skip into with John Samet? Really one of the leading experts in this field for many years. I won't say how many. Highly respected. He served the country and the world really on this topic.
Thanks, thanks, George. Actually, I want to modify the introduction to say I'm absolutely unqualified to be sitting up here talking about the topic, and anything I'd say will come from sort of the.
Well, no, but I think this regulation, the air quality index question,
No,
you're an expert on.
We'll get there. So
Yeah.
generally, to talk about this, so a couple of points, and this is something we're working on at American Thoracic Society that fits, but in terms of the question of the health professions, I think that focus between warning, which might be AQI, it might be dust storm is coming, it is, however, rated how serious, and then society has to do something. And presumably that's at governmental levels and at individual levels. And those systems need to be in place, and we need to know that they work under these circumstances. So I think there's a lot of work that we might call implementation involved here that should be done and could be done using methods that we have available. My clinical background is pulmonary medicine, long forgotten, but if I were practicing under circumstances where dust storm events did occur, I would work with my patients to counsel them about what to do. I would need help because I might not know about N95 versus a surgical mask versus just putting a barrier around your airway. That kind of information does need to reach health professionals in these circumstances. For the severe asthmatic, do they need extra medication? Should they be prepared? If the dust storm is coming, do they take an extra puff of their rescue inhaler in advance? So I think these are real issues that health professionals could work on, and places where our professional societies should be taking the lead, I think, in regions where these events occur. So I think there is really, in terms of the overall question of the role of health professionals, I think it's important. I just want to say a few things about the end of the start of the diagram. It says scientific evidence. And now, I'm sorry, I'm going to be heretical for my epidemiological colleagues. Okay, more research is always needed. Let's get that over with. And then the question is, would it matter with the levels of particles we're seeing, whether the toxicity is this much bigger or this much smaller? I don't think so. I think you would still want to take protective and precautionary action.
But at what level do you take which actions? And next door we had a nice session on wildfires, and what Canada was doing is they're taking the ambient standards for urban pollution. Yeah.
So I think
As if
we're
it's
not
the same.
talking about regulation. We're talking about giving guidelines for action, and we're going to be precautionary. And we know a lot about particles. So George, let's make the assumption that these particles, I understand, appreciate everything about size. Let's say they're 50% more toxic. Okay, we'll be that much more precautionary until we know better. So I think the point I want to make is we have enough of a foundation to guide the need for precautionary action. And I think part of where I think more research emphasis might be placed is how do we assure that those precautionary actions are in fact going to work? And I think there's a lot of work that should be done there, perhaps not by epidemiologists, but by our behavioral science colleagues, social scientists,
But
and others.
let me just ask a
Well,
heretical
let's go
question.
through everybody else and come
Yeah,
back and
okay,
argue.
that's a good idea. But I just wonder if the health benefits of that are comparable to taking action on fossil fuels, where you get exposed to every single
Well,
day of our lives.
I don't
There are
think that's
occasional
the comparison.
extreme.
I don't think we want to make that comparison. Sorry, I said
Yeah.
I would be heretical. I hope I got everybody's attention.
Yeah.
And then we'll have something to discuss further. So I better pass the
Okay.
microphone on.
Okay. Yeah, so the third panelist is Rami Alfara. And I have let me get this introduction. They have them in different places. It's principal scientist and air quality lead at Qatar Environment and Energy Research Institute, and Hamad bin Khalifa University, over 2 decades of international experience in atmospheric aerosols and their impact on air quality, climate change, and human health. And the question that they designated for him is, in the last 5 years, have we improved in our knowledge on the size and chemical composition, which we've been talking about? How does this knowledge differ from across regions? Like, what's the Middle Eastern perspective? And how is this knowledge being used to advance our understanding of the health effect of particles?
Thank you. Thank you very much. And thank you, WMO and WHO, for this invitation and excellent session. I have 3 main points to make in my contribution, but the first one is I'd like to frame this contribution along 2 main emphasis points. And thank you, Francesco, and others for already introducing some of these concepts already. I think it's very important and very wise of us to distinguish source regions and receptor regions. The scale of the challenge is completely different. Most of the evidence and most of the knowledge and the science up until very recently came from receptor regions. Southern Europe and other regions where they're affected by Sahara and by transportation. What you see there as big events, Godzilla events and other events, you're talking about tens to hundreds, a few hundreds of micrograms of mass of PM10 as a metric for dust. At source regions, the scale is thousands of micrograms, milligrams for a day or 2 days. So the first point is source versus receptor. The scale of the challenge, the mass, the response factor, the concentration, if the concentration alone, which is currently the only thing we have in terms of regulating health and standards, is mass. This is the next part of the discussion. So the mass in the source region is many, many factors higher than receptor regions. There is very little evidence in these source regions. There's very few studies on this. The second part of this framing is we need to really distinguish, and again, Francesco alluded to this, SDS days and non-SDS days. I can tell you in the Middle East, where a source region, the frequency of SDS events is 10%. 90% of the time, we're not experiencing SDS. 90%. Only 10% of the time, we have dust storms. But during these 90%, at source regions, dust composition, dust contribution to PM mass is very significant. So resuspension of dust, outside dust events, and non-dust storm sources of dust in these source regions is very significant. PM 2.5, probably 50-50, natural versus man-made. PM 10 is more than this, not dust. So these 2 framing points, I think, are very important to continue my answer. But the scale of the mass and the contribution outside SDS, the role of dust is very important and should not be overlooked. When it comes to our knowledge of composition, chemical composition, and aerosol, atmospheric aerosol, particulate matter, really there are 2 things. There's physical and chemical properties. And these, until now, there isn't really definitive research to tell us what is driving the health impact. And the best evidence we still have from many reports is still mass is the metric. We all know that having 10 micrograms of sea salt or natural dust is not the same as 10 micrograms of black carbon from combustion or from wood burning, but we don't have the consistent evidence to set the guidelines and the standards to tell us how this translates to AQI framework. So is it particle number, particle size, surface area, or chemical composition? So all of these very important factors that has to be, and this is where the discussion, co-creating and co-designing studies with atmospheric scientists, aerosol scientists, epidemiologists, clinicians, health specialists, statisticians, that discussion has to really be more from the beginning. When we design big studies, we have to have this expertise around the same table. We've done a lot of work in parallel. We've done a lot of composition work. They developed instruments. We measure composition all over the world. And now people realizing, we need now to get more research funding, so we need to attach this to health after the fact. And the same for the health studies. People in the health community, they design studies, and sometimes they overlook some very important detail. And this is where I'd like to kind of say, globally, for the last 20 years, not all 5 years, there's a huge amount of knowledge in composition with real-time online measurements of composition. The US now has the Ascent network, 15 super sites, research super sites of detailed chemical composition, elemental composition. Europe has Actress, but these regions are receptor regions. At source regions, I'm very happy to say we have one super site in the Middle East in Doha. That's 3 years old now. I hope more of these super sites appear. In China now, there's more super sites. We need this systematic link between the level of detail to the health studies, but we need to move, in addition to epidemiology, we need to go to more real life exposure. We need to understand really what happens to health. Real life exposure in contrasting conditions, to know the real effect of dust. Dust mix, we never breathe things individually, we breathe mixtures, and these mixtures modify. For example, my last example here is the Middle East. We're an area that has naturally arid background, high background of natural dust, but has urbanized massively in the last 30 years. Construction, industrialization, shipping, transportation. That interaction at source between human-made emissions and dust, how does this change dust properties? Both for climate and for health. The pH of dust with sulfuric acid depositing changes maybe liberates components, maybe changes the toxicity, so all of these details have to be co-designed and done in order to get proper understanding and have maybe an AQI that can really reflect the regions properly and get the evidence. Thank you.
So an AQI for sandstorms as that might be different in the touch points. One question I have for you, having spoken many times in the Middle East and had a regulator come up to me, and I talked about the effects of fossil fuels and everything. He said, I wish people would talk more about that, because when I go to our industries, when I go to our port and I say we need to lower the pollution, they say, you want to control particles? Talk to the desert. And
this is really the benefit of having the first research super site in the region. I now developed the evidence from the research on myself and my team, where we quantified that the bulk of the PM 2.5 and PM 10 most of the time is anthropogenic, even in an urbanized arid region.
Yeah.
We presented the evidence, most of it regional, not local. So sulfate is very big in this region because of the industry they have and the shipping. But natural dust, 10% of the time only dust storms. It's for PM 2.5, it's between 30 and 40% only. The rest is all man-made. And these messages have to be backed by evidence. That's why we need more of this systematic evidence in different regions to drive that policy.
Okay, thank you. The next panelist is Kenza Komsai, Associate Faculty at the Mohammed VI University of Sciences and Health. And the question is, that's been promoted here, how has air quality monitoring in Morocco been leveraged to protect public health, and what resources are needed to effectively mitigate the adverse impacts of SDS, and consider the comments you just heard?
Yeah, thank you for the question, and I really appreciate the discussion, and I'm happy to bring the perspective of Morocco to this discussion. And indeed, in Morocco, dust is never just dust. I think we are the closest country to the most important source of emission. So things are a little bit different for us. But what I really want to highlight here is that every dust plume is having a story to tell behind it, story of climate change and mainly the story of the atmospheric patterns. So this is my country. It's the extreme northwestern African country. It's known by the beautiful diversity of topography inside, but what is more important in Morocco is that the location and the location and the location. So we are between three locations. In the north, there is the Mediterranean Sea, and in the west, there is the Atlantic Ocean, and in the south, there is the Saharan desert. Next, please. This means that we have different areas of high and low pressures. So in the south, we have in the Mediterranean, over the Mediterranean Sea, there is an area of high pressures. On the Atlantic Ocean, area of high pressure. On the south, there is an area of low pressure, which is the Saharan depression. And indeed, three of them are whispering their secrets around Morocco. It's kind of, they are playing the DJ through the region's dust playlist. And indeed, we need to forecast this. And we do. But the problem, it seems to me, that we are forecasting this the old-fashioned way. You know, maybe when I was studying 15 years ago or 20 years ago, when I am asked, what is the impacts of dust? I would say, it reduces visibility. This is what was the evident answer before. So I think that we forecast, but it's more not impact-based. And I know that the WMO now is launching the impact-based forecasting, and this is something which is great and which is happening in Morocco. And I know my question is, what is done in Morocco? And indeed, we are very well aware of all these problems, and we know that forecasting dust means forecasting vulnerability. Vulnerability means impact on health, impact on economy, and impact on our ecosystems. And when we consider, and I think that Morocco is very much aware about what is going on in terms of air quality guidelines and all what was launched by the WHO and so on and so forth. And the country has launched in 2017 the PNAIR, Le Plan National de l'Air, the PNAIR. And the first action was to extend the network. And when I dealt with the air quality department in 2016, we had 29 measurement stations in our network. Today, it's 70 stations, and it is expected to be 130 stations by 2030. So in terms of the monitoring of the air, I think we are measuring more than ever. We are measuring a lot. So we have the data.
Are they just getting mass, or are they getting composition and other characteristics?
No, only the mass. So we have 5 pollutants that are regulated, the PM10, PM2.5, and the other.
Maybe you need a super site like in
yeah, but not
Doha.
the details indeed.
Yeah.
So we are doing the measurements. However, it seems that, yes, we have data, but then the health part is not very much aligned. And this is exactly what Karadi said. So it's something which is characterizing the LMIC's context. Another thing is this. So we are very close to the Sahara, and I think it's a very good excuse to say that it's difficult for us to align with the WHO guidelines. And there have been a revision of the air quality guidelines, and it happened in 2023, and it was a wonderful exercise that was done by the Ministry of Health. They did an advocacy, they created reports, they gathered the institutions, and they went to see the Ministry of Environment. And effectively, it was the first time that the PM2.5 was integrated into the regulations, and it started to be measured. And then the threshold was 35 microgram by cubic meter, which is completely different than 5. But it's fine. We are close to the Saharan area or Saharan desert. So this is also something that the revision of the guidelines and the revision of the thresholds and the consideration of the PM2.5. Another thing also which is great that happened in September 2024, and it was under the initiative of the National Weather Service. So indeed, the National Weather Service contacted the health, and we agreed on the organization of a dialogue. And it was the first national climate health dialogue in Morocco. And it was great because basically we don't talk to each other. So whenever we talk with each other, the magic happens. So we had some funding through the GeoHealth Hub conference, and then we did this dialogue, and by the end we came up with a recommendation of the creation of a technical committee. The technical committee was created, and basically when it is technical, it works. So we have, yeah, it's weird, but this is the thing. I mean, we started working, we talked about priorities, and then people are happy, are enjoying working, but then our main question is, how can we make this a mandate? How can we create some legitimacy of the existence of this committee? And by the way, the university did a great job to coordinate this work. So I think in Morocco, there is a great awareness around the scientists, the practitioners, the policymakers. However, there is the lack of the data of the health. This is for sure, and this is holding us back. And also, there is a huge work that should be done on the ground so that we can get to the policymakers and convince them.
Yeah, the implementation is the hard part.
Exactly.
But perhaps what John is saying with the physicians, the medical community can make a difference.
Yeah.
But we've got to move along because I got two more people.
Yeah, just I will conclude saying that when we want to forecast that, we need meteorology, and we have it. When we want to forecast the risk or arrest the risk, we have chemistry, and we are halfway. But when we want to protect people, we need coordination, and I will not comment.
Okay, thanks. Yeah, so Daniel Tong is next, and he's a professor and director of the Center for Satellite and Earth System Research at George Mason University, and chair of the WMO Sand and Dust Storm Warning Advisory and Assessment System Initiative. And the question, well, you can respond to some of the things you've heard. I'm sure you have opinions about that. And the question, though, was how has regional and national early warning systems and dust forecasting changed since the publication of the WHO Air Quality Guidelines, Good Practice Statements on SDS in 2021, and what else is needed to make it work?
Yeah, thank you, George. I'm going to follow up with some of the questions you asked. I think I have some good news first. Under the WMO SDS Awards, we are actually a network of coordinating research and operational centers trying to provide a forecasting. So I'm going to actually have a slide. Yeah, this one is one of the examples. We have 4 centers that Sarah mentioned earlier, and they're doing regional forecasting, including one that covering your country. We have these global models. This is CAMS by the European Center. Mark Perriton is there. He's one of the developers. So their model actually, they have a global coverage, and you can subscribe to their service. There's also alert service. Actually, you can designate a location and for a specific aerosol type, like dust or wildfire, right? So that's very nice. And what is also nice in this kind of services, they can provide chemical composition data. So that will be helpful for us to study health impact and also for source attribution, like what is causing the exceedance of PM2.5 standards. Is that natural dust, wildfire, or something else? So on the next slides, I also want to shout out for the work that SDS Awards group is doing to develop this dust product for health applications. So we have been very fortunate to work with a lot of dust centers, and we pick up 4 of the best. And that's the NASA European Center, the Naval Research Laboratory, and the Finnish Meteorological Institute. We came up as a long-term dust, high-resolution dust dataset. This is the ensemble dust reanalysis. This product has been used for the NANSET countdown last year for their 2024 report. The main message from that report, because we don't have time, is the global climate change causing more than 30% of increase of exposure, population exposure to very high level of dust globally. That's the 5-year average from the time we began in 2020 and then the time for now. The last slides I want to cover is the economic impact, right? So we talk about the impact assessment. This is one experiment we did in the United States. Dust storms, sand and dust storms have many impacts, right? On health, on agriculture, on transportation safety, and renewable energy, right? How do you put a price tag of this impact? we came up with a number for the United States, which is not known as a major dust source. It's more than $150 billion per year. And majority of this, it's not surprising, is by the health impact, about 60%. For this study, health impact of dust in America, you have to know the American dust, I'm not just talking about United States, and talk about North America, Central America, and South America. It's very unique in that they carry a kind of fungus called coccidioides, and it causes lung infection. That's the valley fever. Actually, it's a fast rising disease, and we still do not know what's causing it, what's the remission. There's no health intervention right now. The only message we give to people is stay inside on windy days. That's all we have. Yeah, and another thing I want to shout out is if you put the dust impact to the other the so-called billion-dollar disasters, dust actually is higher than wildfires and other storms. It's only beaten by tropical cyclones in the United States.
All right, thank you. Great. Yeah, but I think that's an interesting point about the biologicals in there and infectious and endotoxins. And, I think we need to, look more at that because that it's different than the urban aerosol, and yet we're applying the urban aerosol standards and warnings and say, oh, it's a red day or something, and it's not based on studies like that. Anyway, okay, and last is Andrea Seeley, meteorologist at the Caribbean Institute for Meteorology and Hydrology, a senior lecturer, meteorology at the University of West Indies, and Pan American Chair of the WMO Sand and Dust Storm Warning Advisory and Assessment System Initiative. And, along the same lines, what early warning and emergency response systems for sand and dust storms exist in the Caribbean? And what are some of the challenges faced in that region?
Okay, thank you, and good afternoon, everyone, again. This part of the discussion is rather timely because Sunday was World Meteorological Day, and the theme for 2025 is closing the early warning gap together. So this part of the discussion is actually extremely timely. So to just get right into it in the interest of time, basically to answer the first question in a nutshell, what do we have? Now, I haven't highlighted everybody here in the Caribbean that would have some kind of forecast system, forecast methodology, or early warning system for sand and dust storms. Just wanted to highlight a couple instances. The Barbados Meteorological Services, they've started to do color coding in terms of their forecasting, and they've done that as well for sand and dust storms. So whenever we have Saharan dust incursions, they actually do a color coding based on slight, moderate, severe threat in terms of the dust haze that you have. Back to one of the points that was made earlier in terms of forecasting, traditionally meteorologists look at dust in terms of haze. So they always make it sound like it's more so a visibility thing. So you still see that coming out in the information that you get, the wording. But some Met services take it a bit further. Trinidad and Tobago and some of the others do take it a bit further in terms of applying a Saharan dust index or air quality index and actually talking about the implications in terms of health. And others are doing it as well. We have some other territories that would be doing that. Puerto Rico, they're US territory. We have the French Caribbean, so Martinique, Guadeloupe, they're under Météo France. And there are others. Antigua and Barbuda, I know they actually put out advisories. And I'm not sure how detailed their advisories are, but I know they do, because whenever there's a dust incursion, the director of their Met services would always WhatsApp me and blow up my phone. So I know they're doing it. And there are others. So there's so many of us in the region, and I'll allude to that in the next couple of minutes as I talk. So on to the next slide. I think that's my last one, but then I'll go into some other points in a bit. So basically, we also have the CIMH Sahara Dust Advisories. This is for the Caribbean community health sector. So we run the WRF-Chem model. As you would have heard, we host the Pan American Center for the WMO SDS was. So what we've tried to do is actually get the information directly out to the health sector in a grand way, covering as many people as possible. So we would do the health at the Sahara Dust Advisory. send it to the Caribbean Public Health Agency and the Pan American Health Organization office in Barbados to disseminate to their networks. We've had some challenges with that in terms of the staff or contact person. We would always have quite a bit of a turnover in whoever we would have to send the information to for it to get out. And also follow-up and feedback would be needed in terms of, is it getting to who it needs to get to? Is it what they need, etc.? So this goes into now the part of the question, or the second part of the questions that I'm answering in terms of the challenges. So we know that, as with other early warning systems, when you're introducing an early warning system for a phenomenon, you're going to have a number of challenges. One of the challenges a lot of us would have seen with other early warning systems, and you would get it with sand and dust storms too, that coordination in terms of the multi-sectoral, multi-agency, multi-organization coordination. A lot of us speak different languages. We know the meteorologists, the environmental scientists, we're going to speak different languages to the public health people, to the ministries, and of course to the general public. So we always have to make sure that we get this cohesiveness going. We all have different protocols. We all have different ways of doing things. So that is definitely going to be a challenge for integrating sand and dust storms into EWS, as it is with other phenomena. And if we take it further, and this is also from our Caribbean perspective, we have different territories that have different governing systems, different languages. But the thing about it, when I say different governing systems, the Caribbean is interesting because some of us are French territories. So we're going to be doing things in terms of air quality, dust, sand, and dust storms included, like Meteor France would do, like Martinique and Guadeloupe. Now, Barbados, Trinidad, Jamaica, some of us, we're independent. We were British colonies. So even us who were British colonies, we would do things different because we're independent. So we are all going to do different things to each other because we're independent nations of ourselves. Then you have some that are United Kingdom territories. Then you have Puerto Rico as a US territory. So they're going to do things the EPA way. So you see the dilemma we would have in the region. You can't do early warning systems, and a lot of us are doing it or trying it. But then is there something cohesive across the region? That would be a little bit more difficult. I'm being optimistic here. It might be more than a little bit, to make everything more standardized and cohesive. Now, some of us are together in Caribbean community, which covers a lot of the former British territories. Some are still British territories, are independent, and some other countries have joined Caribbean community. That's something we can do because we have agencies that can standardize. But it would be pretty difficult in terms of all of the different things we have going on in the region. Of course, you have things like the differing infrastructures, differing monitoring equipment, capabilities in terms of modeling, etc. And that's where you need, for example, in Barbados, we run WRF-Chem, and a lot of other islands may not have the modeling capability we have at CMH. So we find that when the early warning systems, the forecasts go out, they usually rely on our forecast as a regional entity. And so that helps in terms of getting that information in terms of predictions out there to those who would not be able to do their own modeling. So that's one thing that really helps in terms of that challenge. Communication gaps kind of overlaps with some of what I've already said. You have the different sectors, you have the different languages, and I already kind of alluded to that as well. And we could talk about that some more. Something that's interesting you don't always get when you have to implement these systems. You have what is called inadequate analysis of behaviors. So basically, you want to find out, and some people have done this, have integrated, in early warning systems, or have introduced early warning systems, but have you looked at and gotten feedback and follow up on, is the information getting to who it needs to get to? What do they think about it? Are they acting on it? So that's something that's also a challenge when you're looking at integrating sand and dust storms into the early warning systems whole framework in the region. And one more thing I wanted to look at, or pretty much sum up and say, the Caribbean region, as with other regions, we have multiple hazards, multiple natural hazards. So when you're looking at the implementation of early warning systems, it can make things kind of complex. And so basically, when we're looking at integrating sand and dust storms, we have to look at a multi-hazard early warning system approach. And how that would work. Well, it works for other hazards because we do have multiple hazard early warning systems. And to integrate sun and dust storms into the mix now, you would need to continue or carry over that approach into that integration. And with that, I think that's it on my end.
Okay, well, thank you. Just one last quick thing. You presented and you showed the air quality index for sandstorms, and then your PM 2.5, and the sandstorms had a higher cut point. Is that because it's PM 10, or is it that you just have a higher red cut point?
Which one was that?
You had the air quality index and the action levels, and where it was unhealthy, and if you go back, I don't know if you can do it. Yeah,
it's
here.
Probably Trinidad.
Yeah, so there it's like very high is red, and you're talking about 255 micrograms, and then red over here, well, they're not that different too. When you go earlier, 40, the levels are, cut points are higher.
One is Sahara Dust Index, and the other one is just AQ,
Right. But I'm just saying these are generally higher cut points. In other words, for action levels, are they both PM 2.5, or are they is the sampler different?
Oh, you want to know if it's 2.5 or
PM 10?
For the most part, we do both in terms of AQI
so
and dust index.
These standards are for PM 2.5
what
levels?
they've done,
it doesn't say, but
they've used the WRF Chem model.
Oh, I see.
Which is our model that we run at CMH. A lot of the
so if these are
services,
estimated levels.
So they would have
the model
information
gives you
for prediction for both PM 2.5 and PM 10.
Anyway, so it's not clear, but I'm guessing those are PM 2.5. I don't know though.
I would have to look at it.
Yeah.
I just wanted to show it as an example.
Yeah.
But
I thought it was interesting that they're not the same as they're not the same, which is something that we should consider. Should they be the same, or should they?
That is definitely something to consider. For sure. Yeah.
Okay. Well, thank you all very much. We're over time a little bit, and I want to thank the staff, and Sophie had to go, Sophie Gumi, but thanks to the I studied meteorology at MIT, World Meteorological Organization, and the WHO for setting this up, and thank you.